alcohol wipes, an under pad, a 4x4 gauze, lubricating jelly, clamps, a bulb syringe, scissors, drape cloth, and baby powder. Prepare for delivery. We're going to place the pad down, absorbent white side up, plastic waterproof side down, and put the drape over the patient's abdomen and thighs for privacy. I have 2 pairs of gloves for the next part. You'll be given 3 antiseptic wipes. For this demonstration, we're using alcohol wipes. You're going to use one at a time. Take the wipe out, wipe from the top to the bottom of the labia. You're going to have biohazard materials. You're going to put it in your biohazard bag. Take the next wipe from the top down the right side of the labia, and again, in your biohazard bag. You're going to take your third wipe, the top of the labia down the left side, and in your biohazard bag, and you're going to take off your outer gloves and put those in your biohazard bag. Gauze, but for this demonstration, we're going to keep it in the wrapper. You're going to take one hand and you're going to diffuse pressure so there's no expulsion of the baby. With your other hand, you're going to go to the bottom of the perineum and you're going to warm up the tissue to help prevent vaginal tearing. To displace the umbilical cord, you'll take 2 clamps, put them about 4 inches apart, and then cut right in between. At this point, you'll take your bulb syringe, press the air out, put it into the mouth, and suction out anything. Put it in your biohazard bag. You want to do it at least 2 times because it's a larger orifice. And then you will do 1 suction in each nostril. Make sure the baby is just below the mother's hips. You're going to get your bulb syringe again, at least 2 suctions out of the mouth. It's the larger orifice, 1 from each nostril. Be sure to place it in your biohazard bag. And now you're going to look at the umbilical cord and see if it's still pulsating. Sure all the fluids have been expressed, you're going to rigorously wipe the amniotic fluid off of the baby, which will stimulate crying, and be sure to put a cap on their head. Healthy newborn should be responsive and have normal breathing and pulse rate. We simulated a normal delivery, but if you notice the baby is not breathing but has a pulse, you can rub their back or flick the bottom of their feet. At this point, you'd take the 1-minute APGAR score. You will then take a 5-minute APGAR score. APGAR stands for appearance, pulse, grimace, activity, and respiration. 30 to 60 minutes, it's time for the placenta to be delivered. You do not want to pull it out, but as the placenta comes out, make sure it's delivered the same way, vaginally. You want to inspect it to make sure it's complete, and then you're going to place it in a bag where it will remain unless there is an emergency which requires the cord to be cut. You're going to place one hand above the pubic bone and the other hand, you're going to start massaging the fundus, just like you're kneading dough, not too hard. This will stimulate uterine contractions, which will help prevent excessive bleeding. Check the perineum to make sure there's no excessive bleeding. There will be a little bit. You're going to take a peri pad. You have the white absorbent side. You're going to tuck it under and place it over. You will also conduct your 5-minute APGAR score.